in the projects, and he carried out with UK, Germany, Reunion Island. He has published 6 books also. He has invited as a resource speaker at various national and international conferences, including Germany, France, various European countries. And he is serving as a nodal officer for Skill Development Center of Excellence, that is Daksha at AIIA, All India Institute of Ayurveda, New Delhi, Extension Center LBS and AA, Kevadia, Sabdarjung, and he is also providing clinical services at All India Institute of Ayurveda, Delhi, Sabdarjung, LBS and AA, Supreme Court, and IIT Delhi. He has awarded with best ongoing students 2 times in 2006 and 2010. He has awarded as a Ashwini Award and Mansarovar Amrit Vaidyam Puraskar also. And he has international projects sanctioned and ongoing with Germany, that is of 2 crore, and national project with ILBS and CCRS and AIIA, that is 1.2 crore. Without further ado, please join in welcoming Dr. Prashanth, and what he promises to enlighten us with the engaging us in discussion in Panchakarma. I thank you. Welcome, Dr. Prashanth, and over to you, Dr. Prashanth.
Respected team from esteemed Banaras Hindu University. So as assigned to me by my teacher and senior, Dr. Rajkalla Madam, today I am supposed to speak on the relevance and scope of Panchakarma academics, clinical and career aspects. So first of all, I want to start by remembering all my gurus, Sri Gurubhyo Namaha. And if at all anything good comes from my words and my actions, I think it will be only because of them. And if it's wrong, I'm sure there are many mistakes in this. It will be all mine. And I'm sure that there will be a lot of disturbances behind me. Don't follow that. Just follow what I'm trying to convey to you. So when I was asked to talk about this in a new series that is being started by the Department of Panchakarma at Banaras Hindu University, Madam had asked me to answer these questions in your presentation. So the questions what Madam has raised is like, what is the importance of Panchakarma in Ayurveda practice? How to be a good Panchakarma practitioner? How to convince or do counseling to patients for classical practice of Panchakarma? And what is the scope of Panchakarma specialty in academics and clinics? And what are the opportunities for Panchakarma students in national and international setups? So covering all these things, I have just made that title, the scope and relevance and academics, research and clinical practice. So we will go one by one in these, answering these questions. And at the end of the presentation, we can have a discussion and clarify your doubts. I'll try to include as much as clarified way of explaining what are these things which I have understood. So as you all know, I don't have to explain Panchakarma therapy. You are all experts in it. And I'm sure that all who are listening to this is also someone who is well versed with it. So I'm not going to explain the 5 therapies or the Purva Karmas related to it, or the Pradhana Karma, or the relevance of Paschat Karma related to it. The question is, what is the relevance of Panchakarma in clinical practice? So as we always tell that Shamana and Shodhana, Shodhanam Tesham na Punarudbhava, that it is always addressing the underlying cause, not just the symptoms, and it will not recur again. This is what we actually keep on telling. So whenever a Panchakarma is done, we expect that there are results seen all of a sudden, but the reality is that always the complete result is seen until the Parihara Kala, and we have to wait until then patiently to observe and see the clinical results exactly. We know that it is always acting in preventive, curative, promotive and rejuvenative mode. So it is something which is very customized and very invasively done as a cleansing therapy. I hope that you are all aware about a recent interview done by a very famous news agency, and they had the topmost doctors of India. One was the director of Institute of Liver and Biliary Sciences, Dr. Sarin, and another was Dr. Naresh Trehan, the owner of the Medanta group of hospitals in India. During this conclave in the press conference, it was asked to them that which is the most best mode of preventive therapy in the world. Their answer was Panchakarma. If that term has to come from their vocabulary, I think Panchakarma has moved a lot. Panchakarma has changed a lot. If you remember, our Honorable Prime Minister Narendra Modi ji had been here in All India Institute of Ayurveda to inaugurate the second phase of All India Institute of Ayurveda, which consists of only one hospital, extra one hospital, and rest everything is accommodations and a pharmacy, and that is a Panchakarma hospital. And if I remember correctly, our Honorable Prime Minister itself used the term Panchakarma at least 3 times during his speech, and that itself is a great importance that is for Panchakarma, because if the Honorable Minister of India can take again and again the name of Panchakarma, that itself shows the relevance of Panchakarma among Ayurveda as the unique selling point or the most important point in all these aspects that's covered in Panchakarma. So even though Panchakarma promises a lot of benefit, when it's properly followed, we should actually understand that it has a lot of true potential in prevention of metabolic and endocrinal disorders, which is the major concern of present scenario. If you look at the various incidences and the scenarios of various metabolic and hormonal disorders that is occurring today, I think India is becoming a capital, not just in diabetes, not just in metabolic X syndromes, but in almost all kinds of chronic ailments. India is becoming one of the capital in having these disorders. As we claim that we have the largest human resource in the entire world, we need to be very much careful about the health of the human resource who we have. So based on that, Panchakarma plays even an important scenario in the national level, wherein we can actually have a preventive care model being implemented through our public health policies and through our public health approach throughout the country by implementing Panchakarma in preventive care, because we have enough evidence to show that Panchakarma can be really very well utilized in managing these chronic metabolic and the NCDs which are prevalent across the country. So as these things are rapidly rising, I think the push that we have to do from our side should be more from the government side to actually implement Panchakarma throughout the country in a preventive format, as well as we need to create evidence to increase the relevance of Panchakarma in the present scenario, like a large cohort study with long period of evaluation to exactly understand the results of Panchakarma even in the Parihara Kala, especially in various metabolic and lifestyle disorders. So I have explained 2 slides. One was the previous slide which was telling about the basics of Panchakarma in its relevance, and the reason why it can be more relevant in today's scenario considering the health status of the country, not just the country but across the world. This is the present health scenario. So as we know that there is a growing acceptance of integrative medicine and holistic healthcare all across the world, not just India. The last visitor who came to All India Institute of Ayurveda was one of the topmost integrative researcher from United States of America, who is very close to the President Trump. She was very interested to see what is actually happening in the scenario of integrative medicine in India, and she was very happy after visiting All India Institute of Ayurveda, trying to create an collaboration with us to move forward. So the relevance of Panchakarma in an integrative mode of approach in health and disease would be extremely valuable, not just preventive, but also in a very well curative mode. So it always helps to better adapt the body with the seasonal translations. For example, you know that half of the world lives in extreme climatic conditions. And during the change of these climatic conditions, natural diseases or disorders are very common, and people usually try to take things which subsides it for a symptomatic relief, but on the go we know that this dosha accumulates and it becomes a chronic problem throughout the year, causing them real loss of manpower in their working hours. So if Panchakarma is well adapted to adapt to the seasons and changes, then that can be really very well utilized in clinical practice. And we know the benefits of it in removing the toxins to treating the chronic diseases and metabolic disorders, enhancing immunity, digestion. We know the benefits of Panchakarma and Shodhana, Dirghamayu, Smriti, Meda, Arogya, Tarunam, Vayaha. So we know the benefits of it, but we also have to create more and more evidence which withholds these evidence with these explanations that's given about Panchakarma in larger samples and also in wider different population, not just in India, but also in across the world. We need to create these kinds of evidences. So basic question that madam wanted me to convey is how to be a good Panchakarma practitioner. So when I asked who is the audience who's going to listen, madam told that it is the certified PG diploma students after BMS who have got trained in Panchakarma from Banaras Hindu University. So congratulations to all of you who are interested in learning Panchakarma more in-depthly. So basically, we need to have a very good academic qualification, which is a basic requirement for Panchakarma practitioner, at least a Bachelor of Ayurveda Medicine and Surgery, along with some certificate programs or some more intense knowledge, at least by a RAV guru or someone who is practicing Panchakarma. Because the difference in Panchakarma is that it is not something which you can learn by seeing. It is something only which you can learn by practicing, by doing it yourself. You know that. I think you are aware about the Ayurveda network and the number of lecture series which is there in the Ayurveda network. So you should listen the Panchakarma lectures which are there in Ayurveda network by Banaras Hindu University. And it is very clearly telling about the various avastha and the importance of avastha to adopt various treatments. So in personalization, when it comes to Panchakarma, the choosing or the opting of the right treatment in the specific avastha is very, very, very important. And that's something which you should learn in depth when you actually learn Panchakarma with any practitioner. And you know about the timing, seasonal, Panchakarma which is required. So all the basic details which are supposed to be practiced in Panchakarma is something which you are aware of. But make sure that the prerequisites of Panchakarma is very well followed. For example, I'll just give you an example. We always tell Amapachana and we also always tell Samyak Snehana or Samyak Svedana as Lakshanas. But where are we assessing these Samyak Lakshanas? Because to change the avastha from one avastha to next avastha, we need to have some assessment tools, at least a questionnaire, at least a validated questionnaire. So these assessment tools are very much necessary to actually adopt Panchakarma. In All India Institute of Ayurveda, right from 2015, we have adopted to assessment questionnaires from Pachana to Rakta Mokshana, including all the Purva Karmas and Pradhana Karmas and Paschat Karma, to understand what is the avastha of the disease and then to move on to the next state. So with that single step, what I understood is that in all these years, like it's almost 10 years now, there was not even a single complication in Panchakarma, or there was not even a patient who could tell that there is no result with what the Panchakarma has been done to them. So what suggestion I would like to give you as a Panchakarma learner is that always make sure that you do proper assessments. And if you are asking about these questionnaires, where will I get these questionnaires? Don't worry. All India Institute of Ayurveda has recently validated these questionnaires with experts all around the country. And we are trying to make it into a free app. We have made the basic free app. The basic app is ready already. But once it is completely utilized and tested well, we will launch it all throughout the world. Whoever wants to do a Panchakarma practice can really use that free of cost to understand and standardize their treatment modalities to move forward with each step of Panchakarma. Then comes to the post therapy. This is something which we always ignore. To be a good practitioner, I think we should always think about the relevance of Purva Karma and Paschat Karma. We always think that it is only the pradhana karma which is required. Purva and paschat karma is not required. If you remember the flow chart which I showed you before, look at the relevance of it. It is all equal. It is not just purva karma which is important or pradhana karma which is important. It all has intricacies and steps which has to be systematically followed. So what I request is you should actually give very much importance to panchakarma practice when it is aftercare also. And remember, the contraindications are generalized contraindications which are told by the acharyas. But still, we have to have the common sense and logic to understand where not to do panchakarma, where not to perform certain therapies, and that is more important than understanding where to do it. So really learn where not to do, what we are not capable of, and what we are capable of. So basically, we have a lot of myths and misconception. I think I should speak on base of my experience. I have come back from down of south after traveling to Gujarat for my PhD to Delhi. So the translation from south to north or to the west to north was really difficult because patients used to come to the OPD and ask me, "Sir, ये पंचकर्मा मतलब physiotherapy, या मालिश?" So the questions like there were a lot of myths. क्या ये वो योगा वाला जो वमन करते हैं सेंधा जल से वैसा है क्या? So people were absolutely unaware of Panchakarma in Delhi at a time when I was here in 2015. So we need to educate them. We need to keep on educating patients again and again and again and again. So on the process of educating the patients, what I could do is like I could come up with a lot of documentations, a lot of digital formats through which patients can easily access and understand panchakarma, therapies which they are going to do or therapies which they have to do back at home, the patya which they have to follow back at home, the ahara and vihara patya which they have to do. So if you visit All India Institute of Ayurveda, I request you to come to OPD number 6, which is the Panchakarma OPD, wherein you will have the QRs of various patya which is required in specific condition, in specific prakriti or patient. So this is something which we have designed because we have to explain patient again and again what to do, what not to do. So that's one basic thing which you need to be doing as a good practitioner. Another thing is safety assurance. हम हमेशा पंचकर्मा कुछ अच्छा करने के लिए करते हैं, पेशेंट को लाभदायक होने के लिए करते हैं, बट हमें हमेशा ध्यान रखना है कि अच्छा करने की कोशिश में उनको कुछ बुरा ना हो जाए. So lot of adverse events can take place in Panchakarma, especially like, for example, if you do Udvartana, skin reactions and skin rashes can happen. If you do Svedana, of course, burns, scald, everything can happen. If you do Vamana without care, then obviously there can be, Urdhagata Raktapitta, like bleeding from the GI tract. If you do Virechana without care, then there can be extreme dehydration. If you do Basti, as Madhavan sir always used to tell, we feel that that's one of the most easiest therapy which can be done. But I did my first Basti after doing 1,000 Basti with assistance. So if you do Basti, there is chance of shock and death. So we have to be careful and we have to be extremely very cautious in each step of undergoing selecting and adopting a Panchakarma therapy. Main thing when you actually talk to a patient or explain a patient about पंचकर्मा, आपको इधर रहना है 15 दिन, आपको पहला घी पिलाएंगे, फिर उसके बाद मालिश सिकाई करेंगे, देन आपको हम दवाई देंगे जिससे आपका उल्टी होगा. The patient who is listening to this will be absolutely panicked. उल्टी कराएंगे, दस्त कराएंगे. So there is a lot of inhibitions for people personally also. If you understand, the people from the Middle East countries, they are not ready to take Basti therapies. So there are regional differences, there are personal differences for adopting these therapies. So very good education and also fear reduction in the mode of Sattva Jaya, Sattva Avajaya itself. We need to win the mind of the patient. So we'll come to that part of counseling. So we need to win the mind of the patient to make them undergo the therapies. अगर आप उनकी मन और दिल जीत गया तो आधा पंचकर्मा हो गया समझ लीजिए, because he will be cured by you by just viewing you than actually going the therapy. That's why whenever you go for a rounds, the patient keep telling that sir आप आए आधा ठीक हो गया. So that itself is a kind of confidence which you can give to the patient. So I'm sorry, Rajkala madam, I had to take this screenshot. So this is something which I took from Ayurveda network presentation video, which was there. So these are the common questions which comes from a patient when they come to do Panchakarma. So they usually tell, sir, मुझे शिरोधारा करवाना है, मुझे मालिश कराना है, मैं आपकी मालिश बहुत अच्छे होते हैं पंचकर्मा में, मुझे पंचकर्मा करा लो। सर मैंने सुना साठी चावल वाला मालिश तो बहुत अच्छा होता है, आप मुझे वो करा दीजिए। So now Google, ChatGPT, Bard, Copilot, you have thousands of options wherein you can actually know every detail, every single thing about Panchakarma or details of Panchakarma. So patients are well educated. And there are also patients who go to some experts, they suggest something. Sir, मुझे उस डॉक्टर ने विरेचन कहा था, आप करवा लीजिए। मुझे इन्होंने वो बताया था, आप करवा लीजिए। So what you should patiently do as a practitioner is, first of all, be very patient with the patient who is going to talk like this, because this is something which we get to hear every single day when we sit in an OPD. Then make them understand the ethical basics of Panchakarma. Yes, sir, of course, I do understand that you have understood something like this is good for you, but I need to do certain assessments on you. That doctor is also right. Whatever information that you got is also right. But let me do an assessment of yours. Take some time, do an assessment of the patient, convince the patient that this is not the therapy which you are supposed to do right now. We can do it in a later state, but as of now, you have to do this therapy. That is my opinion. According to my opinion, this is the best therapy. So whenever patients are being told like this, 90% of them accept, but 10% are very literate. The more literate, the more non-convincing, more skeptic. So when the 10% comes, what I add on is like the background of the place that where we work on. Like for example, sir, we are not sitting in a regular hospital and telling it. We are sitting in the Apex Institution of Ministry of Ayush and telling you this. We are sitting in a national institute and telling you this. So it is not like what you decide, sir. That is something which we can do, but not now. You have to go stage by stage, step by step. So you need to convince the. And madam's one of the point is that convincing patient for Deepana Pachana is the most toughest part of Panchakarma practice. As of my experience, even madam had worked, we both have worked together along for that Virechana project on gut microbiome, madam. If you remember, we had a change in the protocol itself just because we were not adequate enough with the Deepana Pachana that we were doing. Because as how Pradhana Karma is important, the Purva Karma, Amapachana, is extremely important for Panchakarma practice. So to convince the patient for Amapachana, it is something which is extremely difficult, but then you should make the patient understand what is the stage of his disease right now, how much approximate time does the patient have to stay back to get a Panchakarma treatment done, and how can he be beneficial? What are the probable outcomes? Within what time can he expect the probable outcomes? So if you can give these three details, then I'm sure that any patient can get convinced and stay here. A very recent patient who came from USA had stayed here for 55 days in All India Institute of Ayurveda just to get Panchakarma done. Another patient from UK, he was staying here for around 40 days. I cannot name the people, but among the top 25 individuals of Indian seniority in very important persons, at least 15 have come here and taken treatment. None of them have taken treatment by compromising any part of Panchakarma. Instead, they all have followed right from Deepana Pachana to Shodhana and Samsarjana or Paschat Karma, exactly because we had conveyed them, come down when you have time. Because time is one of the most important things that people doesn't have. So the simple thing, the way how we convince them is that even if you have a car and if it needs a service, you at least leave the car in the workshop for a day or two and try to have another conveyance. So please leave your body to us. We will service it, we will cleanse it, and we will give back you a cleansed body. So let us do that. Take your time. We need at least 15 to 17 days to at least do one shodhana, which is really important to you. So that's one thing how you can actually convince. Another major trouble that we face is online package system that exists all around the wellness centers across the country. So people go there, take a consultation, they come back with the same package. Sir, ये मुझे लिख के दिए, आप ये करा लीजिए. So most of the time, these are classically against the avastha of the patient, because in wellness, it is associated to tourism industry. So when healthcare becomes an industry, profit becomes an inevitable part of that. So to gain profit, if you do Udvartana, the cost would be simple, and if you do a Shastika Shali Pindas Veda, the cost can be 5 times more. So to have more cost, most of these packages will have Brahmana kind of chikitsas, and they have very fancy names across the country. So these packages, most of the times, I'm not telling always, but most of the times can also be very misguiding and very different. So we need to convince and make the patients understand it. And sometimes patient comes that I need 1 month Panchakarma treatment. I have read it. I need 129 days of Panchakarma starting from Vamana to Rakta Mokshana. So you need to make the patient understand what is the most necessary things for you, and till what things that you can do and how much it can be done on your body. So these things depends on the avastha, the bala of the patient, and the time that the patient can spend on inpatient basis to undergo a Panchakarma therapy. So on a daily practice, we face simple challenges like patient compliance. It is really good to listen to the term Panchakarma and to imagine about Abhyanga. But in reality, when you come down, I am making you drink ghee, and nobody likes drinking ghee. So empty stomach drinking around 240, 300 ml of ghee is something which you cannot actually imagine, because it creates udvega by itself. That's one among the sneha samyak snigdha lakshanas. So that udvega is natural. So we need to make the patient understand about it, educate it, and this compliance issues should be addressed. So to address this, as a research institution in All India Institute of Ayurveda, we are trying to modulate snehapana with its order, and the way how it is, to make the adaptability easier, and to make sneha give its own benefits and same properties, in spite of the fact that it can be consumed without any smell or that snigdhata when it is actually consumed. So we are trying to do it as a research project. Then comes the adverse effects. It's very natural to have various small adverse changes. You cannot call it complete adverse changes. These are symptoms that can happen during sneha jiryamana lakshana, sometimes during post basti, sometimes during ati svedana, etc. So these things should be carefully managed. At the same time, you should be aware about all these things like complications that can happen in each procedure that you are going to carry out. Then comes the pre-existing health condition. So you should know that half of Indians are now diabetic or either hypertensive. They have a CAD or at least a mental health issue. So we need to be really careful what not to be done in these people, because it can increase problems that can actually being underlying with them. They might come for a simple trouble like a joint issue or an arthritic problem, but you need to be very careful and cautious, so that by trying to help with that, you didn't increase something else which was underlying and more complicated. So you need to be a bit careful. That's the main mission or motto that I wanted to convey. Time. This is one of the major thing that nobody has today, but in my clinical practice, I have never done a snehapana at home till date, not even to any of the VVIPs in India. Right from snehapana to samsarjana, if a patient is not admitted in the hospital under observation, then I cannot take the responsibility, and all of the patients have done it. So let me tell you a example with a adverse event. So once a patient who was in a government service, a female patient with some psychiatric issues, had actually got admitted to undergo a virechana. During the treatment, initially she had uh, more days than anticipated to get into Samyak Amapachana or Samyak Langana Lakshanas. So during our assessments, continuous assessments, we planned at least 3 to 5 days we will get it. She took around 7 or 8 days to complete the Purva Karma itself. Then the Snehapana also, it was a Pravara Snehi, so she took more days, around 6 days she took to attain Samyak Snigdhata. And post Virechana, on the day of Samsarjana, she came back to me telling that my leave is over, I need to go back. You told 15 days, the days is over, so I am leaving today. So I explained her, madam, as you have done right from the beginning till date, as all these things are important. Same way, you should understand that the Paschat Karma is also important. If you go home, you are a human being, you will have tendencies to take other food items. So, under my observation, if you are here and taking the Samsarjana diet also, then we can complete the post. Like imagine, even if it is a laparoscopy, the surgeon doesn't send the patient as of a sudden. So I always compare it with even an appendicectomy to be done. A surgeon can admit a patient pre-operatively, do the surgery, keep them post-operatively, and nil orally until the patient gets into a normal diet. That's when the patient is left back. Same way, we need to make sure that the patient is also having the time to do it. So I apologized her, madam. Actually, we anticipated these many days, but then due to these lakshanas or observation that we couldn't get in those days, we waited until we had those observation, and I had told you then also we will take more days, so I can give you a medical certificate until the day you are going to stay here. But she insisted because it was her job, so she told me that I am leaving. But the discharge summary which I gave was left against medical advice. So when a discharge summary is given as left against medical advice, she was unable to claim her reimbursement of the money that she invested in undergoing the Panchakarma therapy. So you won't believe, the patient wrote a 12-page letter regarding me, which was one of the best recognitions I ever got in my life, than any certifications or prizes or awards or trophies. It was that how worse doctor I am just because I didn't let her go on time. So sometimes we have to go to the extreme levels also, not to compromise with the patient. But you have to understand what is the later part of the story. The later part of the story is that within 2 weeks, the patient came back to my OPD, and I never talked back to her anything about this, even though all my students who were around were very angry with her. But I had no feelings that she had done so much on writing a letter allegating XYZ. But the fact is, she is a patient and she is not well. The term patient itself means that they are not well, and we should take care of them. So, as a Panchakarma practitioner, we should make sure that we explain them well and clear previously itself, and we also should respect their time and their commitment and involvement to take the treatment. And we also will have a lot of environmental challenges. For example, while right now we know that most of our equipments are semi-crude. I don't tell that it is completely crude. Our cooker-based steam machine can be collapsed at a time. Our steam or electric-based Shirodhara yantra can collapse at a time. So still we need to keep backups, maintenance, calibrations. So that's why we need to follow the National Ayurveda Board of Hospital standards, so that we keep all these intact and a backup ready, so that if anything goes wrong, the planned treatments doesn't have a problem, and the patient can get their respect of time and commitment that they give. And the major part that we need to be always careful when we are practicing Panchakarma is the emotional and psychological support that we give. Believe it or not, even in Snehapana times, patient will have a lot of emotional imbalances. And if you don't visit the patient every day, and if you don't talk to them and convince them and be with them that I am there with you during this journey, then the patient will not be able to consume it. The practice of asking a patient to drink 10 ml, 20 ml, 50 ml, 100 ml at home, and then come back on the day of Virechana for Sneha Sweda, is something which I have not done throughout my life, just because of the fact that I have studied this. And I think this is the major treatment that is most effective and most strongest hand of Ayurveda is. And I don't want to compromise with it even in Purva Karma, Pradhana Karma, or Paschat Karma. So an average stay of a patient to undergo Panchakarma, if any patient asks me, would be around 17 to 20 days to at least do one major Chodana. So this is something which we always adopt here. And most important part, post Panchakarma diet like Samsarjana, right from Rasa Samsarjana to Tarpanadi to Peyadi Samsarjana, we need to be really careful when what to adopt. And also don't forget to give them a Patya chart, including the lifestyle advices according to the condition and avastha of the disease that they are going through. Otherwise, they will obviously, Teshamna Punarudbhava will become Punarudbhava. So please make sure that you actually advise the patient the lifestyle guidelines and diet guidelines post Panchakarma is also very important. So basic thing to counsel is to educate the patient. You need to make them understand the logic of each step of Panchakarma, why Deepana Pachana is required, why Snehana is required, why Svedana is required, why Virechana or Vamana is required, what it is doing. And you should address the common fear misconceptions which we have already talked. Use and show them testimonials, case studies, evidences, reports, published papers. So whenever somebody is afraid, what I tell to the patient when I counsel them is like, the dhairya atmadi vijnanam. First of all, I try to bring back their atmadi vijnanam, telling that, अरे आपने क्या क्या नहीं किया सर, ये तो simple है, घी नहीं पी पाएंगे आप. And then the second thing what I always make them understand is, इस हॉस्पिटल में तो लाखों लोग कर चुके हैं, आपको डरने की कोई जरूरत नहीं. आज तक किसी को कोई कॉम्प्लिकेशन नहीं होगा, आपको भी नहीं हुआ. You won't get it. So you should make the confidence of the patient win it. Then personalized counseling based on patient's needs, medical history. You should spend time with the patient. If you don't spend time with the patient as a Panchakarma practitioner, it will be really difficult for you to become a good practitioner. Demonstrate the long-term benefits. You are actually doing the therapy for certain specific requirement of a patient. For example, autoimmune condition. You want benefit in autoimmune condition, you're doing it. But then explain the patient that after doing the Virechana or Vamana, these are the anticipated results other than this. So what we do here is we always make a pre-investigations mandatory before going for a Panchakarma therapy, and always we repeat it post Panchakarma therapy in between the Parihara Kala to ensure and make sure that the patient himself feels that what is the benefit I have got from this. And all the patients, now we have around 2,500 to 3,000 patients coming to All India Institute of Ayurveda. And we have a waiting period of around 3 to 4 months to get admitted in Panchakarma. And we are having the next hospital coming up, which is going to be functional soon. So only reason for having all these advancements is just because of the word of mouth from the patients who already got treated. आप मानोगे नहीं, यहाँ पे पेशेंट ऐसे आके बताते हैं कि सर यहाँ एडमिट कर दीजिए, यहाँ एडमिट होने से ठीक हो जाते, मुझे उसने कहा. सो आई ऑलवेज से देम, मैं होटल नहीं चला रहा हूँ, मैं हॉस्पिटल चला रहा हूँ, यहाँ एडमिशन के लिए नहीं बैठा हूँ. हम बताएंगे आपको कब कैसे एडमिट होना है. अभी आप ये दवाई लेके ये स्टेप्स को फॉलो करके अगले बार आ जाना. जब आप उस स्टेज में पहुंचूंगा, देन दे फाइट विद मी. ऐसा नहीं है मुझे कहा है पंचकर्मा में, आप पंचकर्मा में एडमिशन नहीं दे रहा है. तो द नेक्स्ट एग्जाम्पल व्हाट आई यूज मोस्ट कॉमनली इज लाइक, दाल में तड़का सीधा तो नहीं लगाते, पहले दाल को तो पकना होता है. सो सिंपल एग्जाम्पल, सिंपल मोड्स ऑफ एजुकेटिंग देम to reach that avastha, to get into that level wherein you can be kept inside as an inpatient to do the proper shodhana and the therapy is required. So trust is something which is very important even in patient-doctor relationship, and that too with transparency. You need to have a very good communication skill with very good follow-up of the patient, so that you even should remember a patient's name who is 10 years past or 15 years past from you. So who you have seen 15 years ago. So that's the relationship and trust that you can, and that itself will create a lot of impact on the patient. So education and expectation setting during the treatment, emotional support, the guidance of each level, each step, making them understand how you will feel. वमनौषधि लिया तो क्या क्या होता है, स्नेहपान करते वक्त क्या क्या होता है, lifestyle integration and maintenance strategies for the rest of the time. So I always tell it is like a recharge coupon. तो आपने अभी शोधन किया तो आपकी शरीर क्लीन है, बट द वैलिडिटी इज एज पर योर रिचार्ज दैट यू आर गोइंग टू follow the lifestyle and diet guidelines that I am going to give you. Until when you follow it, you will not have to meet me. After that, if you continue to do the things that you did before, which caused you into this situation, you will have to come back and visit me with a lesser validity. But you will not believe, there are even central ministers. Today also there was a minister. He was here in our institute to do a Panchakarma Virechana Shodhana. He is doing it for the continuous 5th time. A minister who is presently a current central minister is doing it for Virechana for the 5th time. Every year he comes and get it done. So that's the benefit what they will understand when they actually do it. And every time he comes, he brings at least 4 or 5 extra people, whoever is inside the parliament. And this is how it goes. So always for a good practitioner, it is not a board, it is not a advertisement, it is not a product, it is not marketing which actually benefits or makes him really good practitioner. It is always the word of mouth of the patients who have gone from you. Like how Gandhiji told customer is the God, the same way for us, patient is the God who actually can bring 10 more patients. So behaving with them, counseling them, making them understand, and actually trying to give maximum information is very necessary. So I have told all these points. So as patient is unaware about Panchakarma, please educate them. Saptavajaya to win their confidence is very important. Seek time, always be in touch. You should regularly visit, if not daily, at least in 2 days, you should visit and always be in touch with your residents or the people who are actually taking care of the patient on a lively basis. On 24-hour basis, you should be there to respond back to them. Remember, Panchakarma is a participatory treatment, so we need to make them involve and never compromise with the principles of Panchakarma. Even if it is Paschat Karma, if a patient gets discharged, then it's always left against medical advice. For me, you can decide on what principle or what level that you are going to compromise. As of me, we should not compromise right from Purva Karma to Paschat Karma. We should be confident enough to actually educate and do this. Don't think that I am doing it only after coming here. Whenever I was in Jamnagar or in working in Amrita in Kerala also, I've never made a patient do Snehapana back at home and then come back in hospital and do a Vamana or Virechana and then go back. So we are not running a toilet or a vomitous bowl. We are actually running a hospital and we are Panchakarma experts. We should actually follow the exact thing in the exact way with very predominant observations. Document perfectly from consent form to plan of treatment to discharge summary. I request each and every one of you to document things very carefully, because patients can turn up after 7 years, 5 years, 10 years and tell you that मैंने तब आपसे किया था कोई फायदा नहीं, अभी मैं दोबारा आया. Then your mind will think that अभी फिर दोबारा क्यों आया, तब फायदा नहीं है. तो so if you have proper documentation, you have daily basis of assessments, you have daily basis of things. Now it is all softwares. You can actually involve it into softwares and make things very easily to assess, understand, and involve patients in the complete documentation part of the Panchakarma. Right from consent form for each therapy to admission and explanation of procedure, documentation is really, really important in Panchakarma practice. So what we have done in All India Institute of Ayurveda, we have made bilingual information, IEC material, which will be passed on to every single patient who is admitted here. क्योंकि हर किसी को बताने बताते बताते you will also be like, from 10 years I am doing here in Delhi, so I will also be bored. So that's what I was telling. Because of this continuous education, we have created a lot of materials which we will try to put it in these application based things which can be accessed by everyone all across the world to practice Panchakarma in a very standard format. So you can see right from Udvartana to Nadi Sweda to Vamana to Snehapana, these are individually passed on to the patient as hard copies as far as possible. And wherever possible, if the patient is really educated, we try to give them in a soft copy also, so that the patient actually reads, goes through this, understand, and anticipates and reacts to the things that they go through on a daily basis. Like for example, Shirodhara karke, the masseur tells not to take bath for a day. आप शाम को नहा लो, नहीं तो ये तेल का पूरा फायदा चला जाएगा. By evening, the patient will get cold. So we need to give clear-cut standard set of instruction as per the classics without compromising with the principles of Panchakarma. So on a bilingual mode, we have actually tried to compile all the procedures right from Purva Karma to Paschat Karma, and we distribute to the patients on a hard or soft format. So on a concise note, in-depth knowledge is very much necessary to understand and follow Panchakarma, and also you should have very good knowledge about the contemporary research. And Panchakarma is something which you cannot just learn by listening to people or understanding the concepts alone. It's something which you should do it. अगर अभ्यंग या उद्वर्तन करते वक्त, when we go as examiners, by looking at the way how a student stands in front of the patient, we understand how many patients they have done an abhyanga or how many patients they have done a उद्वर्तना. क्योंकि खड़े होने के लिए भी एक पोस्चर और एक पोजीशन रहता है जिसमें आसानी से वो कर सकता है. So it is a skill which you should understand and gain by doing it. So as a scholar from undergraduation level to post graduation or PhD, please do the therapies. The more and more you do therapies, you will understand more and more insights into it, how easily, how well, how much pressure, what direction, what is the benefit, what is the difference in the skin areas that we are doing the therapies, what is the temperature that can be average maintained, how is the easy way to actually remove or put back. So lot of insights can be gained by doing it. Maintain high ethical standards ethical standards, especially I want to tell when it comes to the ethical standards of dealing with the patient. Remember, this is some place where patients come to us with complete trust with very little clothes to undergo a therapy. So whenever I take a Panchakarma technician class, the first thing that I tell is a person only takes away clothes with most dearest or most nearest one, and the second one who they will be taking clothes with you with taking off clothes to do some therapy is a Panchakarma technician or a doctor who's conducting Panchakarma therapy. So maintain high ethical and moral standards when you're actually doing it, and be compassionate with the patient care, as it is told in classic Putravat Samupacharet. Like we should actually consider the patient like our own child or children. Stay updated with the recent advancements in Panchakarma and promote evidence-based things while practicing with traditional medicine, and focus on patient-centric care, because it is a continuous learning process. I'm still learning things, and the first picture that I showed on the seashore depicts that in the field of Panchakarma or Ayurveda, I still feel that I've not even touched the first wave which is there on the shore of the sea, because it is so much to learn, and it is so much vast enough, which is really curious enough to learn also. So the more you practice, the more you involve with patients, you will be really good enough. So these are the classical qualities that are explained for a Vaidya to be a good practitioner. So you should have profound knowledge, experience, Daksham, Dirthartham, Shastrartham, Drishtakarmam, Shuchi Pishak. So all these things should be there with strong willpower, devoted to patients' well-being, and also being a Nitya Adhyayi. You should continuously learn what are the recent things that's happening around your science, especially when it comes with Panchakarma, new things that is developing in Panchakarma should be aware for you. I think even this webinar series is also something to explain you about what are the recent things that's happening around with Panchakarma. So academic evolution, if you look at, so we have covered a clinical part of it, patient counseling part of it. Now we are coming to academic evolution. So you know that as a specialized discipline, it is getting more and more popularity. In the past, it was a part of Kaya Chikitsa and it was not separated. So if you look at our ancient gurus and teachers who were actually the senior most teachers in Panchakarma, all of them were the experts in Kaya Chikitsa. But today, when we look at the teachers who are experts in Panchakarma, around 15-20 years back, it has started. So almost all the teachers who are in Panchakarma as a specialized branch is the ones who have only specialized in continuously conducting Panchakarma therapies from past 15 to 20 years. So there is an increase in research validation, there is an increase in standardization of education globally, and there is also integration into the conventional medical sciences. And there is a lot of importance given by government and the people across the world also to preserve the traditional knowledge systems. So when you look at an undergraduate level, postgraduate level, and doctoral levels, Panchakarma is trained and researched on different levels. On a foundation level, you will have these undergraduate level programs with BMS, where we have a basic idea and a basic understanding of Panchakarma, and a lot of experience which can be gained during internship, and also going for such certificate programs and under RAV gurus where Panchakarma is practiced inside. When we actually do that, you can have real good practice. Let me give you a very funny clue also. If you look at the most famous and most best Panchakarma practitioners who are recognized across the country, remember, almost all of them are BMS practitioners. It's just because of the fact that they are actually doing it very classically without compromising with any principles of it, in a very own setup where 100% is self-source, right from the medicine to the therapist, to the therapy being carried out, to the entire things that they are conducting. They are absolutely the ones who are actually responsible for it. Coming to postgraduate and post-doctoral level, you know that basics of research is being understood during the post-graduation level. And in a doctorate level, in PhD, you can actually go much more deep into the research of Panchakarma and understand various type of latest things that can be done. Even interdisciplinary things can be done. So as you know that on a level 1, we will have a basic understanding. On a level 2, we will have an advanced study. Individual therapies, what are the indications of lepa, what are the difference, what is the difference between a lepa and upanaha. So like simple intrinsic things that is there inside Panchakarma can be very well learned. And in third level, it's not just learning, but you can also validate and evaluate what are the efficacies and do very good clinical trials or very good research projects which are there in Panchakarma. So as an infrastructure, we have specialized departments in Ayurveda colleges, and we have built-in treatment facilities, specialized faculties with clinical expertise, and we also have integration with other departments. Like always, Kai Chikitsa patients will also undergo Panchakarma. We have Shalya patients also sometimes coming for Panchakarma. And when it comes to research centers, we have dedicated research centers. If you are not aware, there is a National Ayurveda Research Institute in Panchakarma, which is there in Cheruturthi, Kerala, which is one of the center of excellence of Central Council of Research in Ayurveda Sciences, CCRAS, which is a very good institute which is conducting very good research works and also very good standardization projects on Panchakarma on a regular basis. Collaboration with biomedical research institutions. For example, in All India Institute of Ayurveda, we have a lot of collaborations, and for Panchakarma department, we have collaborations with various IIT like IIT Jodhpur, IIT Delhi. So I'll give you an example. In IIT Delhi, we have developed a Upanaha, we have developed into a ready-made patch, a biomedical patch, which can actually maintain the heat, maintain the warmth throughout, so that the Upanaha principle is followed. The medicines which we need to prepare as Upanaha by a patient can be made as a ready-made patch, and it can be just sticked, and the clinical study is ongoing. Then we have documentation centers for traditional knowledge. AIIA is one of the center where we are actually standardizing, validating, and doing various researches. And 1 second, I just tried to hide. Yeah. And also we have a lot of international collaborative research programs. So even though it is not specifically in Panchakarma, we have pushed in many projects. We have applied for European funds. When it comes to Panchakarma internationally, the most difficult part is giving something internally. You should understand why yoga was so popular and why there is an International Day of Yoga accepted by United Nations is just because we are not giving anything internally in yoga. We are performing yoga. So it is a non-invasive therapy. So Panchakarma can also be differentiated into a non-invasive therapy by doing therapies externally, not going internally with the body, right from Amana to Virechana or Basti, but doing rest of the Kriya Karmas which are external in way, so that we can actually try to establish basic evidences of Panchakarma to move further to make them accept the real things. By then we can do real good clinical studies in India. Once those results are coming out, we can actually make everyone around the world convinced about the real things that's happening in Panchakarma. So academic significance has expanded considerably because of the recent developments in research aspect, in education, in integration, like what I told, like various IITs. Like for example, there is a triple IT in Kottayam. In that triple IT, we are manufacturing an automatic Parisheka Yantra. So we do Parisheka now with a Kumbhika or a Kindi or something, which is very crude in way. When a patient comes down and lie down, they think that why are you doing this? If it was to do this, I would have taken bath at home. So what if I am actually innovating it into a temperature modulated petrol pump like machine, which can come like a sprayer, which can actually be portable and be used by everyone who is practicing Panchakarma across the world to adopt a Parisheka. So such kind of innovation should come from every research aspect, every education level, to make it more popular and more adaptive. Interdisciplinary studies, like we have to compare the efficacy. We also have to have collaborative research where what is the, like for example, post-stroke rehabilitation. We know that the Pakshagata, we have a very good result in comparison to physiotherapy alone or physiotherapy and yoga. So there are many studies which have been conducted in post-stroke rehabilitation, wherein Panchakarma, yoga and physiotherapy together, and only modern medicine, Panchakarma alone. So like, multiple comparative groups, which is going to give us a clear-cut idea which is the best and fastest way of improving the patient's quality of life by doing Panchakarma therapies. Then publications. It's not just the research which is ongoing, but the publications that have been there on the web is much more. Actually, I had few screenshots to show you. When you search the term Panchakarma in PubMed or many indexes across, what is the basic number of articles that's being listed? It's 4,000, 7,000, 9,000. Google Scholar list around 9,000. In PubMed, you will have around 7,000 or 4,000. So when you specify the term, the number of articles becomes lesser. So we claim in our Ayurveda research database of our research database from Central Research Council around 47,000 articles. But we need to be careful that we should publish these research works in very good, indexed journals so that it can reach across the world and the acceptance of Panchakarma becomes much more and more. Believe me or not, more and more Panchakarma researches are carried out outside India, which are published in reputed journals. And when you actually look at the methodology, it is not Panchakarma which is done, but the term Panchakarma is being used. So you have to be careful. अगर आप अपने चीजों को अपने पास रख के अच्छे तरह से जो करना है नहीं किया तो कोई और लेके जाएगा इसको. So curriculum development, you know that NCISM is revising all the curriculum, especially with Panchakarma also it is being revised. So there is a large committee all across the country, and my head of the department, Dr. Anantram Sharma, is the chairperson of the revision of the Panchakarma syllabus committee in NCISM, right from UG to PG to PhD course curriculum. So you will have modern interpretations, practical training with assessment. I think rather than a theoretical thing, this will be more skill assessment oriented as a Panchakarma speciality, because this is not just theoretical, it's more and more practical. So therapeutic consideration, and we also have various small time training programs, and I want to also bring your attention into that, which I'll tell you in detail. So there are many emerging areas in education also: integration with diagnostic methods, evidence-based protocol development, documentation and standardization efforts, ethics and patient safety, certificate programs in integrative medicine, specialized courses in Ayurveda institution like what you just did, international recognition and research grants for Panchakarma studies. Like for example, there is an international Interreg fund, which is a funding done by European Union. So we have applied with a foreign university, which is the largest university in France, Central Health University, on a post-COVID stress management on healthcare workers with simple Shirodhara and Abhyanga. We have put up the proposal, and if that is sanctioned, that can be one of the best studies which is funded by some external agencies other than India, some other country actually trying to fund a study on Panchakarma, and then we can actually conduct that. The only demand that the people who are collaborating with us internationally raises: train our people to do Panchakarma, train our people to make Panchakarma things, and we will practice Panchakarma things under your guidance for a certain period of time, and then we will completely practice. So they want to empower their citizens. You cannot keep this as your own thing and always claim that it is mine and I will not give it to anyone. So we know that Vidya Danam, it is the Sarva Dana, say Sabse Pradhan. So you should actually make them more and more educated and make them aware, so that the benefits of this reaches the world and everybody actually makes it much and much useful. So cross-cultural adaptation techniques. There is a lot of research fellowships and doctoral programs. Like, for example, you have UGC NET exam, which you can qualify and even go for a PhD in an IIT itself for developing a biomedical device in Panchakarma. So many such things can be done. Publication opportunity, especially as a reviewer, is also there in academics. And complementary medicine modules, like for example, WHO has recently published the standards of Panchakarma practice. So you can be a part of such programs in education to develop and to contribute as a practitioner of Panchakarma. So you know that professionally we need to have registration and recognition from a state and central board. But let us also understand that there are other boards which is existing today. For example, imagine after your Panchakarma certificate program or PG program, you are going to start a small center where you are going to train the therapist or masseurs or Panchakarma technician, what we call. We brought the name Panchakarma technician to bring them the same value of a lab technician who is doing a intrinsic lab test, because we are going to train them for a year. They have a national curriculum and they are going to be 100% employed. So there is a Rashtriya Ayurveda Vidyapeeth based Ayurveda training and accreditation board, which gives accreditation or standards to the small setups which are actually going to train short-term courses or short-term programs, not just in India, all across the world. and All India Institute has already got a level 1 of ATAB accreditation, and we have already applied for the level 3. Our assessment is also over. Then there is Health Sector Skill Council. The Health Sector Skill Council is having an Ayush subsector council which has around 16 courses listed under them. All of the courses are now the national qualification registered courses. This comes under Skill India. So any course which is conducted under this, the candidate will get a Pradhan Mantri Kaushal Vikas Yojana wala National Skill Development Corporation skill certificate, which makes them eligible for a job opportunity internationally also, because there is a national standard qualification framework which tells the level of each qualification. For example, the national standard qualification framework of a doctor is level 10, because the doctor can independently take any decision and do his work, perform his work by own. But a Panchakarma technician stands at the level 4, because Panchakarma technician is always going to take the advice of and conduct any therapy as advised by the doctor. So there are many accredited institutions and training programs. So these are also present in Ayurveda colleges and also private institutions which are giving, like famous hospitals like Vaidyaratnam has a certificate program, Manipal has a certificate program. So many institutions all across the country has certificate and training programs. So you have foundational courses, you have advanced learning courses, and you have certificate programs. Everybody in the country runs these programs in their own name. अगर मैं ही मेरा कोर्स चला के मैं अच्छा हूँ बोला तो कोई फायदा नहीं है ना, इसीलिए हमारा इंटरनल असेसमेंट होता है और फिर यूनिवर्सिटी एग्जाम होता है. वैसे ही असेसमेंट और एक्रेडिटेशन में भी हमें we need to assess, affiliate and accredit with a third party organization to any kind of training that we are conducting. So whenever you go for a training program also, you should understand that मेरा जो training है, who it is affiliated to, who is going to accredit me with the training certification, because that makes the third party assessment, which makes your qualification more valid, more stable. तो ये आपको जानना जरूरी है. So I'm just bringing your notice into one of the areas which is probably not known to you or not very much known to you. So we have a center of excellence in skill development in Ayush called as Daksha. Daksha is one of the common quality between Vaidya and Paricharaka. So Daksha stands as an abbreviation for the term Center of Excellence in Development of Ayush Knowledge and Skilled Human Resource for Young Aspirants. अब ये दाक्षा के अंदर हम पंचकर्मा टेक्नीशियन कोर्स से लेके क्षारकर्मा टेक्नीशियन कोर्स और आयुर्वेदा डाइटिशियन कोर्स चलाते हैं ऑल इंडिया इंस्टीट्यूट में. अब ये दाक्षा जो ऑफिस है, इट इज एक्चुअली accredited with ATAB, which you can see on the right side, and it is also affiliated to Health Sector Skill Council as an organization. अभी इसके अंदर जितने भी फैकल्टी टीचिंग कर रहे हैं, राइट फ्रॉम मी टू ऑल माय कोलीग्स whoever is involved in the teaching of Panchakarma technician, they have to get certified every 3 years. Recertify करना है अपना certification को as an accredited teacher. We have to give an online test on Panchakarma. We have MCQs, we have Viva, we have everything to be certified as an accredited trainer for this. This is just to keep yourself updated and upgraded. So it is not just about students who is being tested and accredited or certified. It is also the teachers who are going to be accredited, tested, and trained again and again. So ऐसे you can also actually start and run such courses at your small setups or institutes which is affiliated to third party, which can actually train young students. अभी ये पंचकर्मा टेक्नीशियन का मैं एग्जाम्पल बताता हूँ. इट इज अ 12th पास कोर्स. 12th के बाद जो भी स्कूल नहीं कर पाया, कोई भी सब्जेक्ट का हो, अगर वो 1 साल का ये कोर्स किया, तो आज तक हमने 58 स्टूडेंट्स को 7 बैच में चलाया और लास्ट बैच अभी 6th बैच 7th बैच अभी चालू है. एग्जाम इज ऑन द कमिंग मंथ. 6 बैचेस आर कंप्लीटेड. 100% प्लेसमेंट है ये बच्चों को, और इसमें अराउंड 10 to 15 स्टूडेंट्स जो है वो परमानेंट जॉब में है, हु इज अर्निंग 12th स्टैंडर्ड पास के बाद they are earning around 65 to 75,000 permanent government job as Panchakarma technician in various government sectors. Now, as private sector, they are starting with the salary of around 17 to 20,000 if they hold this certification of skill council, because that is a very valid certificate. और आप भरोसा नहीं करोगे, all these people who are actually running these courses are उन्हें ढूंढे जा रहा है, and people come here for campus selection and interviews in our institution to take these students as soon as they complete. Already 3-4 companiयां पूछ चुका है, corporate companies who are running Ayurveda hospitals across the country, they are actually running behind to get these skilled manpower who is able to undergo, who is able to conduct Panchakarma technically very well. So this is also a very good area and opportunity which you can dive into, because skill development programs are very much necessary in Panchakarma. Now it is just Panchakarma. Now already there are 16 courses listed in the National Qualification Register. You can take up any of them and make yourself much more oriented as a employer than a employee, है ना? तो जॉब देना बेहतर होता है जॉब सीखने से भी ज्यादा. So you should be an employer and an entrepreneur than a employee. So training and certification trainers, certification program developers, quality control inspectors, SOP development specialists, safety and hygiene trainer. So you come to any NABH hospital of Panchakarma accredited hospital of NABH hospital, you can find that every procedure will have a SOP which is displayed next to the area which is conducted. For example, any kind of Svedana will have a step-by-step SOP how it is going to be conducted. So there are many organizations outside also who is actually developing this educational qualification and standards. So it is high time that we also keep our qualification and standards intact and ready. Otherwise, tomorrow they can claim that it is their things that we need to follow. Now coming to अभी academic or skill opportunities मैंने बताया. Now coming to the research opportunities. I don't think I have to speak much on this because it is very well aware. You know that lot of clinical studies, innovative therapies, pharmaceutics, equipment manufacturing, बहुत सारे चीज में आपको scope है. So these are the various areas which you can actually work on advancing research and focusing more on the research aspect of Panchakarma, biomarker identification for Panchakarma's efficacy. Like we had done a study on psoriasis, on the effect of immune biomarkers in psoriasis. We have just completed a study with THSTI on the effect of gut microbiome, on the customized protocol on a Amavata patient, like giving various stages of Amavata treatment as per the Prakriti. We have designed a huge protocol with each medicine as per the Ayurveda classical management, what is best. And then we assess them pre, during, and post, what are the changes in microbiome. So same way, you can have integration with modern diagnostic techniques, like for example, after doing therapies, taking radio imaging and understanding what is the changes that has happened, standardizing of protocol for research validity. And now we have IU informatics with a lot of computational analysis which can be done on a prepared model. Like for example, I'll give you an example. We did a study on the role of Avipatti Churna, which is one of our very commonly used yoga. On Madanafala, already IU informatics study is available. Avipatti Churna found to be very beneficial as a preventive medicine in breast cancer cells. So it is a pre-clinical IU informatic based computational study. So it's under publication. So a lot of such things can be done in Panchakarma. And I think the challenges is the varying interpretations. So we need to have standard interpretations. There is regional variations in practice. It can be accepted to a level based on the temperature, climate, everything. But then whenever Panchakarma is done, like for example, people used to tell that if you need to do Panchakarma, you should go to Kerala. And then our director used to tell that आपको वहां जाने की जरूरत नहीं है, केरला तो इधर ही है, आप इधर ही करा लीजिए. So if you have a closed environment where you are actually modulating and keeping the temperature in a normal level, then why can't we do Panchakarma everywhere? Why should we not do anything in winter? You are not going outside in the winter. You are actually staying inside the hospital. You are restricted inside the hospital during that stay period. And your body is not getting it, Canada में ऐसा है तो लोग कैसे जिएंगे when it's snowfall? When it's snowfall, how people will live in the extreme climate condition. So it's just because of the climate that's maintained inside. So we can do Panchakarma throughout the year without any complication if we can actually maintain the this one. I really would like to congratulate the efforts taken by CCRA, especially National Research Institute in Panchakarma, who is developing consensus, clinical consensus protocols. Rajkala madam and I was also a part of the Virechana protocol, which was recently developed. So clinical consensus protocols are being developed so that we get real standard protocols. And I think we can actually digitalize all these things so that it can reach the hand tips through an application in a phone everybody can practice it. So we will take steps to, in whatever way possible, to actually make it available to everyone. Balancing tradition and developing metrics. Academic research has should be investigated on genetic impact also. We recently conducted a study on the effect of mRNA. I'll just show you that. Exploring neurological benefits and cognitive enhancements, preventive enhancements. Like I'm just showing you two examples of ongoing studies in AIIA. So development and validation of a smartphone application for the assessment of Samyak Lakshanas of Vamana through content analysis of vomitus by digital image processing and artificial इंटेलिजेंस. रिमेंबर, दुनिया आर्टिफिशियल इंटेलिजेंस की जमाने में चल रहा है, और हम अगर अभी भी वही पुराना वाला इसमें पकड़ के बैठा तो वी विल नॉट बी एबल टू मूव फॉरवर्ड. सो यू शुड आल्सो कीप एडवांस विद द टेक्नोलॉजी एंड collaborate with the technology to actually improve and move forward. So this is a study on an anti-aging effect of Virechana Karma in healthy individuals assessed through exosome-derived microRNA as an explorative study. So these are studies which are right now ongoing. So we should actually come up with explorative and innovative studies which are latest as per the present scenario. So I don't need to talk about Panchakarma's evidence. I am skipping it. So you know that I've already discussed the scope of Panchakarma, developing STP, SOP, standard treatment protocols or standard operating protocols, defining the operational goals precisely, keeping the practical applicability, developing empirical measures for Panchakarma procedural outcomes and practices, demonstrating standard Panchakarma procedures with measurable outcomes, and exploring quality control measures for more uniform Panchakarma practices. I'm not going through all these publications. You know it. You can search it and you will get wonderful publications on Panchakarma's evidence. So I think the challenges and the future direction is somewhere like, already Insurance Regulatory Development Authority of India, IRDAS, accepted the recognition and reimbursement of Ayush therapies and practices as equivalent as what is there in modern medicine. As it is done right like that now, after a lot of struggle and fight by developing standard treatment guidelines, standard treatment protocols, etc., there will be a lot of chance for misutilization of this. जहां पे किया नहीं वहां पे किया हुआ लिख के देना, कुछ करना और कुछ और लिख के देना. So there is a lot of chance of actually misuse of this insurance recognition. So as Panchakarma practitioners, you also have a career opportunity in the insurance sector as insurance medical officer to verify and check the condition and the therapies that is being prescribed, whether it is right at or can be reimbursable through a insurance. Now you know that latest budgets have put FDI on insurance. So every foreign company can come here with direct investment on Indian market to insurance sector and invest on insurance, and they will also be liable to give Ayush insurance benefits, which will be creating more and more opportunities for Ayurveda doctors, especially Panchakarma practitioners and Panchakarma trained people to get into the insurance sector. You need to look into the regulatory considerations across the region, like what I was talking about the world. For example, in Nepal, Bhutan, Sri Lanka, we can practice Ayurveda as how it is like Bangladesh and Pakistan. But then when it comes to European Union, specific countries have specific regulations. When it comes to United States of America, among the United States, each state has different regulation. Like California might be a bit more open, but not the rest. Each one has a different way of actually considering and adopting the traditional medicine. Integration with the conventional healthcare system should be very necessary. Quality control and practitioner certifications should be adopted regularly, and maintaining quality standards is one of the things which can actually improve the outcomes and future of Panchakarma. So clinical practice, I think this is also one of the points that madam has actually asked me to do. So in clinical practice, we can do private practice in hospitals and clinics, and also integrative clinics by integrating with the modern medicine hospital. Remember now, every modern hospital in India, right from Apollo to Medanta to Max to Fortis, everybody has an integrative clinic which runs Ayurveda and Panchakarma. Because now all the major hospitals in India have understood when it comes to private sector that Panchakarma is one of the major money-making sector. It can have a lot of commerce. So as they are all commercial hospitals, Panchakarma is one of the most viable things. So you have a lot of job opportunity there also. We have an example of a department of integrative medicine in Safdarjung Hospital. Also, you can actually make specialization in your own area from Panchakarma. In being a neurology in Panchakarma applications, in musculoskeletal condition, in autoimmune condition, in metabolic conditions, in mental health conditions, including de-addiction, which is one of the major concerns now. Dermatological focus, you can, a lot of people are running a lot of successful hair to skin clinics across the country and the world. Reproductive health, one of the major issue. So these are certain focus which you can actually do. So I will just give you an example. One of my students in post graduation had asked him to do a thesis work on benign prostate hypertrophy with Uttara Basti, and it had very good results. And the only thing that I advised him after that is to start a clinic of his own, or Panchakarma center of his own, which is only managing benign prostate hypertrophy. And I am 100% sure that he will be extremely successful, because if you can give results to the patients, there are billions of benign prostate hypertrophy patients who doesn't want to undergo surgery. Most of the time people come to Panchakarma because of the fear of surgery. So we can actually give them improvement in quality of life and avoid a surgery right from AVN to BPH. Then why not? You can start these specialization clinics. So preventive healthcare, I've already talked a lot about it. I think I've exceeded time a lot. So I just want to show you an example of a discharge summary format that we follow in All India Institute of Ayurveda. So it's very well documented, right from the complaints to investigations to the procedure that is being carried out, right from number of days to date, and the procedure with the medicines, and uh, also the assessments. If you look at the right side, this is the assessments. Assessments is not just meant only during thesis work or research study. Why can't we do assessments in every patient who is discharged from your hospital? If you can actually follow that, then I am 100% sure that the practitioner of Panchakarma will be 100% above than any other practitioner in the country. So please follow the assessments whenever you document a Panchakarma case. These are the opportunities. You have integrative centers. Geriatric centers will be one of the major thing. You remember Japan, Singapore is having the highest number of, China, all of them is having the highest number of age population, and they want people to take care of them. You know, the people who go from here to UK as nurses, if any of them have wife or husband, what they do in UK is to be a elderly caretaker, because BMS is not valid there. So they become an elderly caretaker. So if we can slowly introduce Panchakarma into various Western countries, I am sure that all of them will get a very good job opportunity in this geriatric care. So do some basic understanding and courses in geriatric care. If you migrate to other countries with Panchakarma knowledge also, you can obviously practice it. Maybe not legally, but you can practice. The luxury wellness pass, which is associated with hotels right from Burj Khalifa to every other hotel in the world, you have luxury wellness spa which has Ayurveda. Believe me or not, the government of Abu Dhabi and their largest hospital have come down to AIIA, and they have asked us to visit them to start an integrative center of Panchakarma there. Rehabilitation centers is picking up. Sports medicine recovery centers is very much there. If you know that there is a large sports medicine center in Thrissur under the government of Kerala, which is a big hospital based on Panchakarma. These are our centers. So we follow Panchakarma centers in various models. One is wellness model, which we have as an extension center in Statue of Unity, world's largest statue and the tourist attractions in Kevadia. So people will think All India Institute of Ayurveda ko tourist that is wellness or preventive center which we are running there. So all the people who come there as tourists, we convince them to do Panchakarma, and we get them do the Panchakarma there during OPD Panchakarma is there, and they send them here for the IPD Panchakarma whenever necessary. We have a standalone Panchakarma center above the modern medical center. As soon as you enter Lal Bahadur Shastri National Academy of Administration in Mussoorie, and that is a standalone center where Panchakarma is being carried out, and the statistics is very high in comparison to the modern medical center which is existing. And everybody, right from Prime Minister to our secretary, has congratulated the people who are running it. There is a Department of Integrative Medicine, which is a collaborative center which is running in the 6th floor of new emergency block in Safdarjung Hospital. You need to understand that the Medical Council of India has made it mandatory that Department of Integrative Medicine posting for internees 1 month should be done during their MBBS curriculum, and they should be made aware about Ayurveda and other allied medical sciences during their curriculum. So based on that, this integrative medical center at Safdarjung Hospital in New Delhi is becoming so successful that this is the statistics. In around 900 working days, we had around 25,576 Panchakarma procedure. And these are referral patients, and OPD around 40,000 OPD patients. And it is located inside emergency medicine block. Emergency medicine block means casualty की 6th floor में हम हैं, और उसके अंदर बिना एक advertisement, बिना कुछ, these many patients are coming, and 80% of the patients are referred by the modern doctors or the practitioners who are like nursing staff or the staff of the hospital itself. So this is a very good model of integration, and based on this, Ministry of Ayush have started integrative models in all major allopathic hospitals in Delhi. So I have told you this already. So these are the scope. We need to have extensive training and basic training in basic life support to handle situations like hypovolemic shock or MI should be trained for any Panchakarma practitioner, and it is open to all. If you go to any country outside India, everybody knows how to operate a CPR machine or anything which is there. So a cardioversion when to be done. So it is important to be aware of possible complication, advocate uniformity, quality standards. So research areas I have talked about. These are the integration areas. I'm skipping as it is already very late. Scope of Panchakarma in academics. These are the various areas. This also we have discussed. I think public health is one area which we have a lot to contribute, and we still have not yet completely involved. Community wellness, community purification and community packages, including Panchakarma into national health programs, which will also be some steps which will be taken by Ayush very soon. So Ministry of Ayush is on to it. So soon we can see a lot of opportunity for Panchakarma people in community health way, like National Ayush Mission, etc. Integrating into holistic practices along with other practices like yoga, etc. And career opportunities, I think I've already explained it in an indirect way. I want you to be entrepreneurs than an employee seeking an employment, because I think there is so much opportunity in Panchakarma, especially if you are a Panchakarma trained person. You can be traditional practitioner, specialized therapist, or academic position. You can go to wellness industry. You can go to product developments like Panchakarma products. For example, where is a Basti combination? Why can't you package it into a you have kashayas, you have churnas, everything. Why can't you actually package a Madhyama Matra Basti, what do you call, from Kalka to Kwata, Churna, everything into a single package, including Saindava, everything. So things becomes easier. So it's a stage of innovation and more necessity, right? From product development, not just the instruments, but many things which is being used in Panchakarma practice can be involved. Digital health, you can develop digital wearables or digital things which can actually monitor the Panchakarma patients during this. If you remember, through e-Sanjeevani app of Government of India, I myself consult patients at least twice or thrice in a week with patients from Mussoorie and various different parts of the country. So entrepreneurship, you know that AIIA has an ICANE, which is an incubation center. Medical tourism is extremely relevant today. Ayush has introduced Ayush visa, which means a person visiting to India doesn't have to wait for a visiting visa. He can apply for Ayush visa. All he needs is a certificate from the hospital, or a letter from the hospital, or an email from the hospital. And we have all the foreign patients coming to Delhi to All India Institute of Ayurveda to take treatment in Panchakarma from Ayush visa, because it's processed within a week and it's cheap than a visiting visa to India. And it can be a complementary therapy in hospitals. I've already told online consultation, teaching and training. We can teach the skill development programs in Panchakarma technician, Panchakarma attendant, Panchakarma assistant. So all these are the various opportunities. Entrepreneurial rules, opportunity, you know that eco-friendly Panchakarma, sustainable Panchakarma products, time-efficient protocols, corporate wellness integrative packages. Ideas are innumerable. Lot of things are there which you can do. The only thing is you should actually come out and do things. So that's something which we are not trained in as grown up as Indian children who are not supposed to take risk. But if we were anywhere outside India, I'm telling outside Asia, probably after the age of 18, we will not be allowed to stay back in home. And we should have found out our source of earning with the education that we have already got or what we are already undergoing. So remember, now the Indian students are going outside. Our brothers, sisters, and younger children are going outside India to learn, earn, and pay back their education loan. So we should actually take these risks to start startups, innovation things. In All India Institute of Ayurveda, again, we faculties are planning to give a startup as a Panchakarma company and start manufacturing various Panchakarma products. This is an example. There is a Jalauka breeding unit also. This is also a very good opportunity. If you even just breed Jalauka, if you're happy with aquarium and aquaponics, you can breed Jalauka and then you can be the largest supplier of Jalauka across the world, not just India, because there is a lot of demand of it. So this is in AIA, okay? So you can do that. Scope of standardization and quality control, there is a lot of scope. Documentation, current challenges, future directions. I think all these things we have discussed. We need to develop digital platforms for Panchakarma learning, simulation-based training methods, virtual reality applications, international student exchange programs, interdisciplinary education models, and these are the research and development scope, which is including clinical efficacy, mechanism of action, integration, standardized protocols, biochemical and physiological effects, documentation, and exploration of new applications. So trends in Panchakarma. Let me come to the final point. That's the recognition of global acceptance of Panchakarma. WHO, you know, that traditional medicine strategy has been developed, and WHO has established the Global Traditional Center for Medicine in Jamnagar. The construction is ongoing. First group of recruitments is over. So it is going to be the traditional center for medicine, which is looking after traditional center of traditional medicine of 200 countries. But in association with that, they will be setting up a hospital, and I'm 100% sure that there will be a Panchakarma setup in that hospital too. So that will be one of the largest Panchakarma setup across the world, which will be set up. So every place, everywhere, when it goes to traditional medicine, the relevance of Panchakarma, the scope of Panchakarma is ever increasing, and we need skilled, talented, and confident people who can come forward and actually take up this responsibility. So you know that there is benchmarks of practice for Ayurveda. This is a WHO document, and this is having practice of Ayurveda health information, specifically Panchakarma. And there is Panchakarma special packages developed for from WHO itself, that is also being published. In All India Institute of Ayurveda, we have people coming from all across the world, and there are people who comes as groups on a regular basis based on our MOUs, like partners from Germany, partners from Brazil, partners from Portugal, partners from France. So they all come, and we regularly give Panchakarma training programs to them on demonstrating Panchakarma procedure. Believe me or not, they are very, very curious and really practicing Panchakarma much better than us, than what we do here. So if things go like this in a very near future, I think we will have to borrow Panchakarma from somewhere outside the country and understand things. So I have actually discussed all these things. International opportunity, just to mention that there are many Ayurveda centers in various countries. Some of them are legally accepted, but the main problem comes with the regulatory aspect of giving a basti or giving a virechana where internally invasive medicine is done. So what the practitioners do, like for example, you have a lot of practitioners in UK, a lot of practitioners in California, a lot of practitioners in Netherlands, a lot of practitioners country. You take any country, you have practitioners. It is illegal to practice because it is not legally validated through any of the government regulatory body. But it is as same as practicing acupuncture or acupressure in India. So if the patient is giving written consent, if there is no much legal obligation, then you can probably practice. But Panchakarma practice is also limited and restricted. As of my knowledge, Pradhana Karmas are avoided and only the Purva Karmas are done. There are centers which do Pradhana Karmas, but in a very minimal and a very light form, not exactly at how it is practiced in India and really said. So there are destination wellness retreats and countries like Indonesia, Bali, Thailand, Vietnam, Mexico. So there are a lot of spa centers wherein you can yourself go and ask for a job opportunity and get settled to promote Panchakarma. cruise ships is all around the world. You can actually go into a cruise ship and talk to them that I have such a program, I have such a group of people, I am ready to run your center, I'll start a spa inside your thing, which is genuine. There is a lot of private practice also. We need technology integration. Internationally, we need people to develop, this international coding of diseases, which has been recently released by AYUSH through WHO. So internationally, Panchakarma physicians in wellness centers, e-commerce, teaching, insurance sector, validation, uh, conferences and networking. Of course, Panchakarma people are all around. And current status and future trends, as it's increasing in acceptance, government supports is also there. Inclusion is there too much, and there is a lot of emerging opportunity, right from e-consultations to personalized treatment protocols to digital documentations. So this is the future landscape which we can expect with this growing scientific validation and rising healthcare cost across. You have to understand that the healthcare cost is extremely high, but we have to make sure that Panchakarma is not made too much costly and not made as something which is not affordable and very luxurious. So it should be affordable to everyone. It should be something accessible to the private, to the public in every form, and it should be practiced by everyone. So growing influence in the developing countries for this cost of medical expenses is actually asking them for alternatives. And if we can prove that Panchakarma is really evidence based and really something which can give results, they all will adopt it. Digital connectivity is expanding, and that's an advantage. And after COVID, the interest in immune boosting traditional practices have a huge demand across the world. So you need to focus on known pharmacological approaches in the beginning stages, and later by step we can actually adopt the entire Panchakarma across the world. So to conclude, it's your mind, attitude and intention that decides what you will be. So be pure, true and honest to what you have learned and what you are going to practice. So the destination is yours. All the teachers that you have been is like this boat guide who is actually riding the boat. The direction that you tell will be the shore that where you want to reach. So be right enough to exactly judge where you want to reach. I sincerely want to acknowledge all. Thank you. Thank you all my dear students and patients. I'm really sorry I took a lot of time.
Thank you, Dr. Prashanth, for such an elaborative and informative lecture. Of course, our students are very happy to listen to you. Okay, and doing classical Panchakarma, it's really great experience to hear from you. Okay, and also not leaving patient after Snehapana. It was a great experience, and you have done a great part. Good as a Panchakarma physician, you have not leave that patient after Snehapana. And of course, Putravat Samacharit is a take-home message for the students, for the being a Panchakarma specialist or being a Panchakarma physician. Okay, and it's a really perfect time. What you have mentioned, the perfect time for dal tadka. How to convince the patient for the proper Panchakarma. Like now, today only one patient from IIT came, a professor, and I think this is his third visit just to start Snehapana. I don't know, this is not the proper time to start the Panchakarma. Snehapana will be starting, you just come after 3-4 days. He was shocked that anybody in Panchakarma, like it is like that. I told, take the picture of your tongue. He showed me the tongue. I took the picture and showed. See, this is what the coating means for us. When it get all clear, then you can come for the Panchakarma. So this is what you have mentioned in your lecture. It's so wonderful. Hear from you, and your ability to break down the complex concepts of Panchakarma to the students was really impressive. And examples what you provided, like how to manage the VIP patients, how to manage the normal patients. So it's a, and it will help, or what example you have provided, it helps to illustrate key points in the practice of the students. So thank you so much on the behalf of Department of Panchakarma. I thank you for such an enlightened lecture. Okay. And now the questions from the who have connected online, they can ask the questions, or the student can ask the question.
Good evening, sir. My name is Dr. Prajwal Jaiswal. I am from BHU doing my PGD. Sir, my question is कि आपने एक मोबाइल क्लिनिक का जिक्र किया है. तो मोबाइल क्लिनिक में initially what can be done, sir, and how it can be performed?
Okay, so this is something which was an idea which was provided to me a few years ago by our first director of the AIIA. So what happens is like major trouble with patients in adopting Panchakarma is spending time, okay, giving the time for it. So now when we are running Panchakarma centers, which are centers of OPD procedures, we run a certain sets of procedures, right from Valuka Sweda to Dvartana to up to a level of Matra Basti, not exceeding to that. So if you want to actually conduct these procedures, you visit a Panchakarma OPD center, like for example, the Sabdarjan unit of ours, and then you have a specific time slot wherein you need to go there, get the treatment done, then come back. Why not we buy a Volvo bus and then transfer it into a very good therapy rooms and attach with a bathroom and then take it to some, like example, Kumbh Mela. I am going there and I am giving slots to patients from morning to evening for a certain period of time. So it reaches the community, it reaches the masses. Than like I go to a village where there is a lot of population having a specific kind of disorder. I go to them and I can actually conduct these therapies there inside, which is just, for example, imagine a village which has a lot of Amavada identified patients and they are just taking some traditional medicine. Why can't I go there and get done some Ruksha Svedas? Why can't I do them some what do you call Kshara Bastis in a very Avara Matra and help them with the kind of therapies which they cannot come to the town or city, because Panchakarma is restricted to a town level or a city level or a metro level, but not to real to villages. I thought that it should penetrate into the villages and into the masses, and that too through our public health programs, and mobile mode of actually getting it down to the public will be one way of doing it.
थैंक यू सर. अभी शिवम कुमार जी अपना क्वेश्चन पूछेंगे. आप अपना माइक अनम्यूट कर लीजिए शिवम जी.
Thank you so much, sir. I am Shivam Kumar, a BMS internee from BHU, and during my intern preparation, we have like a vision to reach AIIA-like institution. Currently, I am in a top institution of India, but I want to reach AIIA too. You shared a lot of information today that are really. We discussed such kind of ideas. Like currently, you're discussing about a van, Panchakarma van, and among friends, we used to discuss like this kind of ideas could be done. And thank you so much. You have done a lot of work in Panchakarma. And I have a question. Ki, as a young student, like we have a thought कि कितना टाइम लगेगा like आप जैसे बनने के लिए, राजकला मैम जैसे बनने के लिए. what kind, like starting में पेशेंट तो नहीं आते हैं young scholars के पास. So what kind of problems you faced when you were very young? Like you have patients right now. What we'll do when we graduate?
Yeah, very good question, Shivam. I want to answer one by one. First question was about your interest in reaching AI. So let me clarify it. Look, institution doesn't make students or institution doesn't create people. IIT में भी बेवकूफ पढ़ता है, BHU और जामनगर में भी बेवकूफ पढ़ता है. आप IIT, BHU और AIIA से पढ़ा मतलब ये नहीं है कि आप बहुत इंटेलिजेंट और स्मार्ट हो, कि आप बहुत एक्सेप्टेड हो, है ना. So it is you who have to maintain that standard and you who have to create that ability and confidence in you. Second point, that I am really happy to hear that you are discussing ideas. It's told that great people discuss ideas and very simple people actually discuss about people. So it's really good that you are going in the right track. Third point, मुझे कैसे बनना है ना. कोई भी बनने की कोशिश मत करो, हम भी किसी को भी बनने की कोशिश नहीं कर रहे हैं. We are traveling, everybody has their own journeys, right? So we have to be something special in our journey. We have to make every part of that journey interesting and beneficial for the people who are going to travel behind us. अगर मैं कचरा छोड़ के गया तो उनको भी कचरा ही मिलेगा. Like it is for the next generation. पूर्व जन्म नहीं, इसी जन्म में ही मैं जो करता हूँ उसका बेनिफिट मिलने वाला जनरेशन आपका जनरेशन होगा. So I don't have to wait till my children's generation. So it will be the just next generation who's passing below me, who's my student, who's the next generation to me. So what you have to do is not to become, try not to become, try to be. Okay, explore yourself and try to be. And the fourth question, as a young practitioner, what you face? Very good question. Maybe I have talked everything from a perspective of what I am doing right now. पहला प्रिस्क्रिप्शन में मेरे हाथ कांपा था शिवा।
Yes,
जब मैं
sir.
पहली बार एक इंडिविजुअल पेशेंट को देखे मैं प्रिस्क्राइब किया तो मेरा हाथ कांपा, और मैंने जो लिखा वो मैंने अपने गुरु को फोन करके बताया और इतना गाली सुना उसके लिए, अरे बेवकूफ ऐसे करते हो ऐसे। लिखने के बाद पेशेंट गया तुरंत, उस टाइम लैंडलाइन ही है, लैंडलाइन से फोन कर, सर मैंने ये लिखा, सही है क्या? है ना, मैंने लिखा था एक सोरियाटिक आर्थराइटिस पेशेंट था, फर्स्ट पेशेंट हम भूलते नहीं, फर्स्ट लव जैसा है। तो वो सोरियाटिक आर्थराइटिक पेशेंट को मुझे क्या लगा, सोरियासिस है, आर्थराइटिस है, तो मुझे देना है आर्थराइटिस की गुगलू, और सोरियासिस है तो त्वक रोग है ना, तो मैंने गुगलू तिक्त का क्वाथ दिया, है ना। ऐसा कुछ मेडिसिन इसी लॉजिक पे दिया था, उस टाइम की लॉजिक उतना ही था। पर मैंने गुरु से गाली सुना, अरे ये नहीं, ये अच्छा था, ये दे सकता था ये। तो आई वॉज फीलिंग रियली नॉन कॉन्फिडेंट ऑफ सी द नेक्स्ट पेशेंट, बट माई गुरु वॉज एक्चुअली ट्राइंग टू मेक मी बेटर, माई टीचर, है ना। तो यू वॉन्ट बिलीव, विद इन अ वीक द पेशेंट रिटर्न, और मैं डर के बैठा था अंदर चुपके कि यार गाली पड़ेगा, वो सर ने भी कहा था ये गलत होगा। पर द पेशेंट केम विथ वेरी गुड एक्सीलेंट रिजल्ट्स, and at that time I thought it is the medicine which worked, but today I understand it is not the medicine which worked, it was the communication which I did with him, it worked. He trusted me and he took the medicine. So as a young practitioner, what I want to tell you is you will face difficulties. कोई भी जन्म से पैदा होते दौड़ा नहीं, सब खड़ा होके एक दो कदम चल के ही आगे चला है। पर वो चलते वक्त भी हमें ये उम्मीद तो रखना है कि चाहे जितने भी मुश्किल आज मैं लूं, आगे it will always benefit me.
Thank you, sir.
है ना। तो don't worry, you will pick up. Only thing is you should be confident and consistent.
Yes, thank you, sir.
बहुत बहुत धन्यवाद सर। और अभी मुझे लगता है कि और प्रश्न नहीं है, क्योंकि आपने पूरे सत्र में जो है बहुत अच्छे से चीजों को एक्सप्लेन किया है। तो आपका बहुत बहुत धन्यवाद कि आपने अपने बिजी शेड्यूल से समय निकाला हमारे लिए और इतना वैल्यूएबल जो है अपना वक्तव्य आपने दिया। आपको बहुत बहुत धन्यवाद। और मैं जितने भी लोग जुड़े हुए हैं उनको एक सूचना देना चाहता हूं कि जो हमारा अगला सत्र होगा। जी सर बताएं।
मैं 1 मिनट इंटरप्ट करना चाहता हूँ सर। अभी ऑडियंस में मैं अपना बहुत अच्छे दोस्तों को देखा, डॉक्टर मृदुल रंजन बनारस हिंदू यूनिवर्सिटी से पंचकर्मा से, और डॉक्टर देवांग वाला है। थैंक यू फॉर ज्वाइनिंग। आपका भी बहुत आभारी हूँ मैं, बिकॉज दे आर ऑल द वंस हु हैव एक्चुअली वी हैव लर्नड टुगेदर। सो रियली थैंक यू, एंड इट इज रियली क्या बोलते हैं, वेरी गुड फीलिंग टू नो दैट यू आर स्टिल देयर लिसनिंग टू दिस। थैंक यू सर फॉर ज्वाइनिंग।
जी जी बहुत धन्यवाद सर, बहुत बहुत धन्यवाद। जो लोग भी जुड़े हुए हैं सभी को बहुत बहुत आभार। और जो सूचना मैं दे रहा था कि अगला लेक्चर जो हमारा अगले शनिवार को होने वाला है, उसमें जापान से हमारे एक्सपर्ट जो हैं डॉक्टर शीहो ओइकावा, वो हमारे साथ जुड़ेंगे और वो अपने अनुभव, वो किस प्रकार से पंचकर्म कर रहे हैं जापान में, क्या क्या वहां पर स्कोप्स हैं और किस तरह से जो है पंचकर्म चिकित्सा को या भारत की जो सनातन संस्कृति जो है आयुर्वेद जहां से हमको ज्ञान देता है, उस ज्ञान को किस प्रकार हम वैश्विक स्तर पर ले जा सकते हैं, अंतर्राष्ट्रीय स्तर पर ले जा सकते हैं, इस पर अगले सत्र में चर्चा होगी। आपने जो है अपना बहुमूल्य समय हमको दिया, उसके लिए बहुत बहुत धन्यवाद सर। सादर प्रणाम।